What symptoms does a person experience before dying? While each person's end-of-life experience is unique, there are some common signs and symptoms that people may experience as they approach the end of their lives. These symptoms typically occur within the last few days to months of life and are part of the body's natural shutdown process. Here are 10 common symptoms that may indicate that a person is about to die. 1. Fatigue and weakness. One of the earliest and most obvious signs that death is approaching is a noticeable increase in fatigue and weakness. This symptom is a direct consequence of the body's declining energy reserves and reduced focus on vital functions. Patients typically experience a noticeable decrease in physical strength and a general feeling of tiredness, even after the slightest effort. Patients may have difficulty completing basic tasks that were once simple, such as getting out of bed, sitting up, or even picking up a spoon. Fatigue at the end of life is caused by a variety of factors, including decreased food and water intake, impaired ability of the body to absorb nutrients, and muscle weakness. In addition, whether it is cancer, heart disease, or another chronic disease, the illness itself puts a huge strain on the body's resources. The immune system is often compromised, and vital organs such as the liver, kidneys, and heart may begin to weaken. This overall decline in physiological function leads to increased fatigue in patients. Fatigue and weakness usually develop gradually and worsen as the body continues to decline. At first, the patient may find themselves easily exhausted by simple activities, such as walking across the room or sitting in a chair. Over time, they may need to rest more frequently and may choose to stay in bed longer. This transition can be difficult for the patient and their loved ones, as it is a clear sign that the body is approaching the end of life. In the later stages, fatigue may become all-encompassing. The patient may not even have the energy to speak or open his eyes. This state of extreme weakness is not usually painful, but is often accompanied by a strong desire to sleep as the body attempts to conserve what little energy it has left. 2. Changes in breathing patterns. Breathing patterns often change significantly as the body approaches the end of life. These changes can be one of the most obvious and disturbing symptoms for loved ones, who may not be sure what is happening or how to best respond. Irregular breathing is a natural part of the dying process and is caused by changes in the brain's regulation of breathing and the body's reduced need for oxygen. Changes in breathing occur because the body's systems are slowing down and less oxygen is needed to maintain basic functions. As a person's energy reserves decrease, the muscles involved in breathing, including the diaphragm, weaken. This can lead to several different breathing patterns that are often observed in the last stages of life. Cheyne-Stokes breathing. It is characterized by a shallow breathing pattern that gradually deepens, followed by a period of rapid breathing, and then a pause in breathing. This cycle repeats frequently, and the apnea periods become longer over time. Cheyne-Stokes breathing is common in patients with heart failure, neurological disease, or those who are dying. It is not usually uncomfortable for the patient, but it can be distressing for caregivers to see. Dyspnea. Dyspnea refers to gasping, labored breathing that sounds irregular and strained. This breathing pattern often occurs near the end of life as the body makes a last-ditch effort to take in oxygen. Although dying breaths may seem painful, they are usually involuntary and part of the body's natural reflex response. 3. Loss of appetite and thirst. Loss of appetite and thirst in dying people is caused by several physiological changes. As the body's metabolism slows, less energy is needed. The digestive system, which normally requires a lot of energy to process food, is now less active. The body prioritizes basic functions over digestion, resulting in a decreased desire to eat. Deterioration of organ function. The liver, kidneys, and gastrointestinal tract may no longer function effectively. As the kidneys begin to fail, the body has difficulty managing fluids, and drinking large amounts of water can be uncomfortable or even harmful. Decrease in physical activity. As activity decreases, their caloric needs decrease significantly. The body naturally adjusts by reducing the desire to eat. Medications and treatments. Pain medications, especially opioids, can affect appetite by causing nausea or suppressing hunger. Other medications designed to control symptoms may also affect a person's desire to eat or drink. Loss of appetite usually begins gradually. The patient may begin to refuse certain foods or eat less. Foods that once brought comfort or pleasure may no longer be appealing. It is not uncommon for patients to express a desire to just take a few sips of water, a bite of fruit, or a sip of ice. This decline can become more pronounced over time. Patients may stop eating solid foods altogether and accept only liquids, or they may refuse to take a sip of water. This can be distressing for caregivers, who may worry about dehydration or malnutrition. However, it is important to remember that force-feeding or drinking can cause discomfort, nausea, or even choking. Altered mental status and confusion. Patients may feel confused, disoriented, or agitated, which may be caused by reduced oxygen to the brain or changes in body chemistry. They may also experience hallucinations or talk about seeing deceased loved ones. Decreased urine output and bowel changes. As kidney function declines, urine output decreases significantly. As the digestive process slows, patients may become incontinent or constipated. Cold extremities and changes in skin color. Hands, feet, and legs may feel cool to the touch and appear bluish or mottled. This is because the heart is no longer pumping blood to the extremities effectively. Social withdrawal. The dying person may become unresponsive, spend more time sleeping, or be in a state of deep relaxation. They may lose interest in social interactions, even with close family members. Changes in consciousness. People may drift in and out of consciousness, or enter a semi-comatose state. Some people feel increasingly sleepy or lose consciousness as they get closer to death. Pain and discomfort. Pain may increase as the body deteriorates, but not everyone experiences severe pain. Palliative care aims to manage this pain and ensure comfort. Increased energy or clarity of thought, final lucidity. In some cases, a person may suddenly become more alert or coherent shortly before dying, which may surprise loved ones. This final recovery is often short-lived. These signs can vary depending on the individual and the underlying condition. It is also important to remember that not everyone will experience all symptoms.